Hello everyone. Let us quickly revise all of the drugs which are used for glaucoma through a very simple and short table in a very quick and precise way. These are all the drugs that are used in glaucoma. The first group is prostaglandin analogs like latanoprost and bimatoprost, and they work on PGF2 alpha receptors. That is the receptor that is involved in the treatment of glaucoma, PGF2 alpha. And the drugs are latanoprost, bimatoprost. You can see it ends with prost, and this is also prostaglandin. So that is how you can remember this prostaglandin. Then you have alpha adrenergic agonists like dipivefrin, apraclonidine, brimonidine. Then beta blockers. So you have alpha agonists and beta blockers like timolol, betaxolol, and levobunolol. Then you have carbonic anhydrase inhibitors like dorzolamide and brinzolamide. Finally, you have myotics like pilocarpine and physostigmine. The first group of drugs we have are prostaglandin analogs. And for the eye, the receptor that is required is PGF2 alpha receptor. So these drugs, all of these drugs which are used in glaucoma, are PGF2 alpha analogs. Okay. And the drugs that we have here are latanoprost and bimatoprost. Now, the mechanism that they act by is that they increase uveoscleral outflow. So they will reduce intraocular pressure by increasing uveoscleral outflow of the aqueous and thus reducing intraocular pressure. The side effects are hyperpigmentation of iris. So the eye that we use it in, the iris of that eye will become hyperpigmented. It will become darker in color. Next is hypertrichosis, which is excessive growth of eyelashes. Uveitis and cystoid macular edema are also important side effects. So hyperpigmentation of the iris, hypertrichosis or excessive eyelid growth, uveitis and cystoid macular edema. Next we have beta blockers. The next group is beta blockers. So beta blockers are also involved in glaucoma, and the beta blockers that we specifically use are timolol and betaxolol. These are the ones that are used. Their mechanism is that they reduce aqueous secretion. So they will reduce the production and secretion of aqueous, and that is how they will reduce the intraocular pressure. They have a lot of side effects which could be both ocular as well as systemic. So if you look at the ocular side effects, you have corneal anesthesia. Okay, if we use beta blockers, since they have a membrane stabilizing action, if we use them on cornea, they will lead to an anesthesia of the cornea. They can also cause blockage of the nasolacrimal duct due to congestion of the duct, and then they also cause blepharoconjunctivitis. Now, these are the ocular side effects, major ocular side effects: corneal anesthesia, blockage of NLD, and blepharoconjunctivitis. The systemic side effects will include bronchospasm, bradycardia, and congestive heart failure, among a lot of other side effects of beta blockers. So these are the systemic side effects of even of topical beta blockers. They can cause these systemic side effects, and that is why they are contraindicated in asthma. Since they cause bronchospasm, they are contraindicated in asthma. And we know that beta blockers raise blood sugar levels, so they are also contraindicated in diabetes mellitus, and they are contraindicated in arrhythmias as well as congestive heart failure patients. The next group of drugs are alpha agonists. So in these we have dipivefrin, apraclonidine, and brimonidine. These are the alpha agonists used in glaucoma, and how they work is that they reduce aqueous secretion and they increase trabecular outflow. They work by both, by reducing secretion as well as by increasing outflow of from the trabecular meshwork pathway. Then, if we look at the side effects, specifically for apraclonidine, we have conjunctivitis and lid retraction. These two are the side effects of apraclonidine: conjunctivitis and lid retraction. And for brimonidine, it can cause drowsiness, depression, and apnea. So, all sedating or reducing. Okay, drowsiness, depression, and apnea is caused by brimonidine. And this is why, because it causes drowsiness and apnea, this is why it is contraindicated in children. Brimonidine is not used in children because it has a tendency to cause apnea. Finally, we have carbonic anhydrase inhibitors like acetozolamide, brinzolamide, and dorzolamide, and their mechanism is by reducing